President Biden has unveiled a new strategy to tackle the COVID-19 pandemic. The measures are designed to help slow the spread of the Omicron variant. Several cases of the new strain have been confirmed here in the U.S. It was first detected in South Africa. Speaking at the National Institutes of Health Thursday, the president said the nation would fight the variant with, quote, science and speed, not chaos and confusion. Among the new measures are stricter testing requirements for travelers to the U.S., in addition to a campaign to help promote booster shots for vaccinated Americans. CBS News senior White House correspondent Weijia Jiang starts us off.
My plan I'm announcing today pulls no punches in the fight against COVID-19.
President Biden revealed his latest strategy to combat COVID-19 as the U.S. confirmed at least 8 more cases of the Omicron variant, including a Minnesota man who attended an anime convention in Manhattan just before Thanksgiving, an event that drew about 50,000 people, and a woman from Colorado who recently returned from Africa. Both patients were fully vaccinated.
She is experiencing mild symptoms and is isolating at home.
Tonight, preliminary data shows Omicron is almost 2.5 times more likely to reinfect people who previously had COVID.
Experts say the COVID-19 cases will continue to rise in the weeks ahead in this winter. So we need to be ready.
As a new strain spreads, the president announced that all international travelers, including Americans and those who are fully vaccinated, will be required to get tested 1 day before coming to the U.S. And in a new effort to track cases, private insurance companies will have to reimburse people for at-home COVID tests. So far, they have been expensive and in short supply. Mask mandates will also be extended on planes, trains, and public transportation through mid-March. But vaccines are at the center of the president's plan. Hundreds of new family vaccination sites will open up, focusing on giving shots to children, and there's a big push to get people boosted.
Go get it now.
71% of adults in the U.S. are fully vaccinated, but of those, only 21% have gotten a booster shot. Health experts say vaccinations and boosters are critical, especially now that Omicron is here.
It's probably already more widely spread than our early determinations have indicated, and it will spread further because it is highly contagious.
And Weijia joins me now with more from the White House. Hey there, Weijia. Explain how this new COVID strategy builds on existing measures that are already in place.
Well, this new strategy really is an amplified version of what the White House has already been focused on. And of course, at the heart of this is vaccinations and now boosters. And so they are expanding a campaign to try to educate people, to try to reach out to people so that they will go and get their shots. We also know that the White House plans to open hundreds of more family vaccination sites focusing on children between the ages of 5 and 11. You see here several elements of his plan, which are already, at least, a version of them already in place. So the mask mandates on public transit and planes and trains will be extended through mid-March. But this is very new, which is requiring health insurers to cover the costs of at-home COVID tests. You see that last point on your screen there, because they really want to be able to track COVID, and they hope this makes it easier for people to do that at home. Of course, right now it's pretty tough to get your hands on a COVID test in some places, and it's expensive. And so they're hoping this will change that. And for those people who are uninsured, the plan is to make testing more widely available at community sites and places that people can access.
And we know for people who don't have easy access to it, those at-home kits are really going to be a crucial part of the strategy. Part of the president's plan also includes requiring all travelers to the U.S. to test negative for COVID within 1 day of travel. This is regardless of vaccination status. I'm wondering, are officials looking to implement any testing or vaccination requirements for domestic travel?
So the White House said today that nothing is off the table as scientists learn more about the variant and as they continue their conversations about what should be in place. As you know, right now there is a travel ban for 8 countries in Africa. And from what Dr. Fauci told us yesterday, he believes that should be temporary, especially now that Omicron is here. So the question is, now that it is here, how do you prevent it from spreading from state to state rather than from other countries to the U.S.? And so that is certainly something they're considering. But right now, I think that they are erring on the side of caution as not to cause a panic of any kind for people who are traveling. They really want to take this step by step. At the same time, they stress that they are considering more restrictions.
So on that point, as you mentioned, there are currently 8 countries that are on that travel restriction list. Are they looking to expand that further? Is there any indication, especially as Omicron is spreading and we're learning that it's been identified in more places, does it look like more regions might be added to the list?
Well, that is also something they're considering. I think they're waiting for more hard data and more numbers to see if they can gauge whether that would be useful or not. Dr. Fauci said that, one reason why they immediately implemented the ban from those African countries was because they thought that's where most of the cases were and where they were coming from. We now know that that there were cases in some countries in Europe even before it was detected in South Africa, which begs the question of what's the point of having this ban against those South African countries, especially when some of them don't have any Omicron detected cases at all. And so I think the White House's message is that they're still studying and that they will change and adapt based on any new information they receive from researchers.
So as we're thinking about the adaptations that may be coming, we've heard the White House pushing Americans to get vaccinated, get their booster shots. You mentioned how they're looking to expand testing availability. But as of now, lockdowns and shutdowns have largely been left out of the conversation. What can you tell us about the possibility and the considerations that the White House is making in terms of those questions?
I think President Biden will do everything that he can to take measures before it comes to that. He has stressed that he doesn't believe they're needed right now and that his hope is that they will not be needed. And that's because when you think about the last time there were those restrictions, when there were lockdowns, we were in a very different place. We were still learning about the very first variant and how to protect ourselves. And the White House says now we know. We have an entire toolbox full of ways to keep safe, including the vaccine, including boosters, including mask mandates in certain places. So they say we're not starting from square one. And by the way, the White House views this not only as a medical crisis, but as an economic one. And of course, they're right in the middle of implementing their recovery strategy. And so they don't want to halt that in any way because they know how lockdowns impact people, how much stress it creates and how difficult it is for people to bounce back. And so they're really trying to take any kind of steps that they can before it comes to that. Of course, we don't know yet a lot about the Omicron variant, and I think they're going to have to adjust based on the new data that comes in the next week and a half or two.
All right, Weijia, thank you.
Sure.